This webinar will demonstrate how to set up for single-rod contraceptive implant insertions and removals. A single-rod contraceptive implant is a thin rod that is placed under the skin in the upper arm. It releases progestin hormone for pregnancy prevention. Implants are safe contraceptive options for most patients and can last at least 3 years. As of November 2011, the Food and Drug Administration has approved the use of Nexplanon in the United States. Nexplanon is radiopaque, which means it can be seen by normal X-ray, and has a slightly different insertion device. The following slides will demonstrate how to set up for an implant insertion. First, set up the exam table for the procedure. The exam table for an implant insertion should include a blue Chucks pad for underneath the patient's arm. Prior to the procedure, patients should have completed a urine pregnancy test. Check with the patient to make sure that a urine sample was collected. Pregnancy test results should be documented in ECW per Unity protocol. In addition, positive pregnancy test results should be brought to the attention of the provider, as the implant procedure may need to be canceled. Document the patient's last menstrual period in ECW. You should also provide the patient with 2 forms prior to the procedure. The first form is an informed consent form for procedures. You will fill in the patient's name, the procedure to be performed, the provider's name, and the patient's name and date of birth at the bottom of the page in compliance with Unity policy. Be sure to write Nexplanon insertion on the line labeled Name of Procedure. Once the patient signs the form, you will also sign the form on the line labeled Witness. Some providers may also have the patient sign the Nexplanon consent that comes in the box, in addition to the Unity consent form. However, the Unity consent form is mandatory. The second form is a 1-page implant education sheet. The patient should review this education sheet and discuss any questions with the provider before signing the procedural consent. The forms you should provide look like this. These documents can be found in the Family Planning Resource Centers located at every Unity Community Health Center and on the Unity intranet. The equipment for an implant insertion should include the Nexplanon implant, non-sterile gloves, sterile gloves in the provider's chosen size, betadine, and large OB cotton swabs for skin prep, several alcohol prep pads for skin prep, 1% lidocaine, a 2 to 5 cc syringe, a needle for drawing up the lidocaine. A 20-gauge 1-inch needle is appropriate. A 21-gauge 1.5-inch needle for lidocaine injection, a Band-Aid for covering the insertion site, sterile 4x4s for pressure dressing, and 3-inch Coben self-adhering elastic wrap for applying the pressure dressing. The remaining slides will demonstrate how to set up for an implant removal. For an implant removal, you should set up the exam table the same way you would set up for an implant insertion. The exam table for an implant removal will include a blue Chucks pad for underneath the patient's arm. For an implant removal, you only need to provide the patient with an informed consent form for procedures. Again, you will fill in the patient's name, the procedure to be performed, the provider's name, and the patient's name and date of birth at the bottom of the page in compliance with the Unity policy. Be sure to write progestin implant removal on the line labeled Name of Procedure. Once the patient signs the form, you will also sign the form on the line labeled Witness. This document can be found in the Family Planning Resource Centers located at every Unity Community Health Center and on the Unity intranet. The equipment for an implant removal is very similar to the equipment needed for an implant insertion. The primary difference is the addition of a scalpel, 2 curved hemostats, and steri strips. The full setup should include non-sterile gloves for prep, sterile gloves in the appropriate size for the provider, betadine, and large OB cotton swabs for skin prep, 1% lidocaine for local anesthesia, a 2 to 5 cc syringe, a needle for drawing up the lidocaine. A 20 gauge 1-inch needle is appropriate. A 21 gauge 1.5 inch needle for injecting the lidocaine, a straight scalpel, a number 11 blade is appropriate. 2 hemostats, preferably curved. Sterile 4x4s for use during the procedure and to create a pressure dressing. Alcohol prep pads for cleaning the skin. Self-adhering 3-inch Coban elastic wrap for the pressure dressing. And steri strips or a Band-Aid for closing and covering the incision. During the procedure setup, you will leave the hemostats in their sterile packaging. This will prevent the contamination of the instruments. Supplies for both the insertion and removal procedures are the same except for the addition of a scalpel, curved hemostats, and steri strips for implant removal. This concludes the implant procedure webinar.